Hi, can you hear me now? Okay. Do you all know the organization I am attached to? Here it says Global Vet Clinic, but in your programs it says another, right? In some of yours, Blue Paw Trust. So I'll tell you the history. Blue Paw Trust is the organization I worked for 15 long years. It is a Sri Lankan charity, and where we did a lot of dog population management work. Unfortunately, it could not survive. It is no more now, and because during the corona, we had to shut it down. So Blue Paw Trust is no more. So after that, I was jobless for 18 months. I'm a vet surgeon by my profession. So I started my own private practice. That is Global Vet Clinic. So that is the background this whole presentation is based on. That is why I wanted to make you clear the history. Otherwise, you will not understand some of the things I am talking here today. So Sri Lanka is a small island country. It is mainly population is mainly Buddhist and Hindus who love feeding animals, any animal. So mainly they feed dogs and cats. And because of that, we have a huge roaming population in the country. And rabies is also endemic. So because of the fear of rabies, other than feeding dogs, people did not take any responsibility. I'm talking about 2005 era. People were not taking any responsibility of the dogs, like they were not petted or they were not taken to a vet when they are sick or anything like that, just fed them with the leftover food from the home. And so roaming dogs was an issue in the country, and our dog registration ordinance is more than 125 years old. And in Sri Lanka, dog population control had been mainly based on dog culling using strychnine and carbon monoxide until 2006. But due to pressure from the animal welfare groups, the president of the country introduced the no-kill policy in 2006. It's a policy only. Law is still culling, but nobody is practicing culling. From 2006, it's entirely dog population management through sterilizations, mainly female dogs. So, as Blue Paw Trust, we and many other NGOs working towards dog population management, and the government have been working tirelessly since 2007, and we have done a lot of female dog sterilizations, and as a result, after 15 years now, we can see a clearly difference between 2007 and 2022-23 like. But unfortunately, I cannot give you the figures. We have not done a study recently to tell you how much it has gone down. So anyway, we qualitatively, we feel that there is a marked reduction in the population. When the female dog sterilizations were happening, dog population has gone down. But on the other hand, we see the cat population has gone up. So cat population has gone up due to several reasons. One is survival of the kittens is high because earlier there were a lot of roaming dogs on the streets, and they attacked the kittens and they died mainly. They didn't survive. And the other reason was increased availability of food for the cats. Since there are less dogs now, the food thrown away from the houses are mainly for cats. And finding a puppy nowadays is a big challenge for people. So because of that, they take kittens, they adopt kittens as pets. And as we all know, dogs reproduce once in 6 months, whereas the cats reproduce once every 3 months. So there is a cat population, increased cat population now. So we need to control the cat population also, because it is a problem now. Because the number has increased visibly and the welfare of cats decreasing, because if they get cat flu or something, it spreads everywhere and many animals die, and a lot of fighting among cats. And some die due to road traffic accidents. And main thing is human rabies cases also going up from cats. So as I told you, when I started my own private practice, I found many people needing sterilizations for cats and dogs. Actually, dogs, I think, I'm not sure, maybe we have sterilized about 50-60% of the total population, and the government is doing it annually in areas, but the gap between when they come to a certain city, they don't come back until 1 year, because they just cover the whole area, just move from one city to the other. So in my private clinic, I found many people bringing community animals, dogs, for rabies vaccinations. They said when the sterilization program came to our town, these dogs were puppies and they were not fit enough for the surgery, so we couldn't get the surgery done. So as a person who has been involved in dog population management for so long, I understand the problem that if they start reproducing, the effort we have put into sterilizing the others is wasted. So we need to get these dogs also sterilized. So what I did was I started doing 1 or 2 surgeries free of charge, because as a responsible person, I did it with my own funds and all. But after that, gradually the numbers increased, and from November 2021 till September 2023, that is until last month, a total of 662 surgeries we have done. Out of that, 65% cat surgeries, because there's a huge demand for cats, and dogs, 35%. Out of that 34% female dogs, out of that 34% females, 82% of the female dogs were less than 6 months old. They have not yet started reproducing. If they started reproducing, it will be a huge problem. So although the number is so low, in a situation like that, where we have sterilized so many animals, if they started reproducing, it will be a big problem. So it makes a big impact in the community. Since I am one person with a small clinic, I had to change the typical ways I did the surgery. Usually we know that when we have a big sterilization campaign, how we are doing, but I changed those protocols and change according to what we can do. Let's see what I have done to achieve these. One thing I did was I offered both dog and cat surgeries because it was needed, and I offered both spay and neuter. The other thing was I got volunteers to do the surgeries, because one person could not do many surgeries, and there was no funds to hire any doctors to do the surgeries. So through volunteers, I got the surgeries done. Some of them are vet students, some are newly graduate vets, so I trained them first, and after that they did the surgeries. And next was publicity. Usually in Sri Lanka, in our dog population management programs, what we do is we paste big posters in the village where people gather, like in boutiques or near the bus halt, like places, and we send a vehicle with a loudspeaker announcing that the clinic is happening on this day from this time to this time. Like even last week I heard our municipality announcing rabies vaccination programs at 10 o'clock in the night, because they say that 10 o'clock in the night is the time people are at home and they can listen to public notices like that. So they are sending at 10 o'clock. But I didn't bother about that. What I could do was I put a message in the Facebook. This message says free sterilizations from September 4 to 8th. And just in one day, it had been shared more than 500 times. So it has gone to the community that this is happening. So publicity is without any cost. And I display a notice in my clinic always, if there are sterilizations to be done, please contact. And the word of mouth is spreading. The other thing is transportation. In almost all the sterilization programs in the country, they send a vehicle to catch the dogs and bring them to the site where they are doing the surgeries. I don't have any dog catchers and I don't have a vehicle. So what I do is I ask the people to bring the animals. Sometimes their own dogs, sometimes they are community dogs. Since the rabies program, dog population and rabies management programs have educated the community, they know the importance of getting sterilized. So they willingly bring the animals to the clinic. Sometimes 2-3 people in the neighborhood get together and pool the money and bear the transport cost, and one person will apply leave and take leave from work and bring the animal. It happens that way. So you can see this lady here, she walked into the clinic with 2 dogs. Look at her age, but she knew the importance. She told me that there is no other person to bring these animals. They have all gone to work, so I brought the animals here. In the motorcycle, the whole family has come with the dog. It's like that. They take the responsibility to bring the animals. And post-operative care. As soon as the surgery is done, as soon as they have recovered, I send them home. And usually these people keep the animals inside their houses and look after them. They say, "Doctor, you have done a great job by doing these surgeries." So I think we need to do our best for the animals, and I will keep the animal inside my house. That is what they say. So they look after the animals. Other than getting the surgery done, they sometimes buy treatment for ticks and collars like that. They do additional things also. Now they go beyond getting sterilized. They apply tick repellents and all, and they take care of the animals. So in conclusion, I can say about 10-15 years time education and engaging in dog population management programs, our community has changed. They have changed in their attitudes. Earlier, the dog was just an animal. Now they see the community dog as part of their community. They are treated lovingly and they take care of the animals. Whenever the community dogs are sick, they bring to take treatments also. So they are willingly taking action for these animals. So it has made a clear change in our community. I think it is the same. I know only about my area, but I think it is the same with the whole country. So I think now Sri Lanka can change the way we are doing the dog population management programs. Like I think we can advertise in the social media, and we can ask people to take the responsibility and bring animals like things, because they have changed. So I think if we can change the protocol, we can reduce the cost, and we can do more surgeries with those money. Thank you.
All right, so we will now open question and answer session for Dr. Ganga. Is there any questions?
Just wondered whether the recent troubles in Sri Lanka, whether that's affected your work and have changed anything in any way?
Oh yes, it affected hugely, because I started this in the middle of Corona, and then after that we had the economic problems. So for several months we could not do any work. Yeah, we were
Unable to work at all
no,
during the crisis?
no, during the crisis. Yeah, finding food was more important than sterilizing dogs. So it had a big impact.
And will that impact continue? Or?
No, now almost normal now. Yeah, back to normal, I must say. Yeah, Karen.
Hi, Ganga. It's really great to hear that you as a private vet, you're taking this on. And actually, the way I see it, I think I hope this is the future. Where
Thank you.
organizations are not maybe required and all that other infrastructure. So that's really great to see. I am curious, is the government at some point interested in doing like a survey to understand the impact of the work that has been done for so many years? Or is that something that they're not?
Actually, I don't think that the government will realize the importance of doing a survey, because actually at one time we as Blue Paw Trust together with HSI, we planned a island-wide dog population survey before Corona, but they didn't cooperate with us. Unfortunately, we couldn't do that. So I don't know whether they will realize the importance or not. Sorry.
I'm wondering that in your country, people would like to keep the dog inside their house or the roaming dog on the street.
It's like this. Sorry?
The owner. I mean the owner dog. They would like to keep in confined owner or the roaming dog.
Usually, local breed, they keep only about 5 to 10% inside the houses, and they are raised as pets. But mainly, they are roaming, because in the rural area, other than the main cities, in other areas, we don't have parapet walls. The houses are just in the village with a fence, so dogs can go everywhere. So mainly, we have community dogs.
So how do you identify the dog that neutrate already?
Sorry?
How do you identify the neutrate dog that you've done?
Neuter or not?
Yes.
We not the left ear.
You're not left ear. Right?
Yeah.
This is very useful for the survey in the future.
Yeah. Otherwise, it's difficult.
Thank you
Yeah.
so much.
Are there any more questions for Dr. Ganga? All right.
I was wondering whether you have or you plan to survey to see what impact your work is having in the areas that you're working in.
My work is having, you mean this small number of surgeries. At the moment, I have not planned anything, actually, because of the, inside compelled like thing that I did this, because I was working for a large organization, and at one point, Dog Trust also funded us. So with all those things, we couldn't do it. So I don't know, but I was frustrated at one point. I just gave up everything working for animals in the charity. That is why I started my own clinic, because then I'm not dependent on anybody, or I'm not working with anybody. I go to my clinic, I treat the animals, I come home. That's it. Because I was so frustrated at one point when we could not survive Blue Paw Trust. So maybe in the future, I have not thought about it.
Any more questions? If there's none, then next we will have
Thank you.
panel session at room 2 and 3. So you guys may proceed to the room which is next door. Right. Thank you.